Everyone, and welcome to Rooted in Healing, Empowering Women in Medicine with Insights from Trailblazing Nurse Practitioners. This is definitely a dream come true for me. Makes me even a little weepy to host these three incredible educators on one webinar. It's an honor to be here with all of you as well. Throughout my career, I've had a unique privilege of knowing and watching all three of these healthcare practitioners, Danny Williamson, Kelly Engelmann, and Lori Esarey, not just grow, but they really thrived and built their privately owned practices from the ground up. I've seen firsthand how their unwavering dedication, innovative approaches, and compassionate care have transformed countless lives. They are not only healers, but they're also true pioneers in the field of functional and integrative medicine. Watching them bloom into some of the top healthcare practitioners in their field has been nothing short of inspiring. I've watched all three of them to continually overcome the multiple obstacles put in their way, which has been a really good lesson for myself in my life. Today, we are fortunate to have them here to share their trusted insights, real world case studies and practical strategies to address some of the most pressing challenges facing women in medicine today. Each of these trailblazing nurse practitioners bring unique perspectives and unmatched expertise. Danny Williamson, nurse practitioner, is a dynamic force in functional medicine known for her passion for radical healing and empowering patients to take charge of their health. Her common sense whole life approach has helped countless individuals reclaim their vitality and wellness. Kelly Engelmann, nurse practitioner, is certainly a visionary in integrative medicine with a deep commitment to addressing the root causes of illness. Her work has revolutionized how we approach holistic health, helping patients achieve long-term healing through personalized care. And Lori Esarey, who I think I've known the longest, nurse practitioner, is a leader in blending clinical excellence with compassionate care. Her dedication to creating sustainable health solutions has had a lasting impact on both her patients and in the field of medicine as a whole. I think the villages where her practice is a healthier community because of Lori. She really spearheads that for that community. These women are not just practitioners, they are mentors, they're innovators and advocates for a future where healthcare is both transformative and empowering. Our chat box should be open for questions, and we've left about 30 minutes at the end for questions to ask all three presenters. They will, I'm sure, weigh in wherever their expertise is. We're going to start with Kelly Engelmann. Her practice is located in Ridgeland, Mississippi. So Kelly, I'd love for you to take it away.
Oh my goodness, Joelle, you're making me like want to tear up as well. You have been such an inspiration. And I know that I can speak for all three of us. Like we would not be where we are without you. You have been encouraging us all the way. We need our cheerleaders out there kind of cheering us on because to your point, we have been through some pretty amazing things. It's been epic, the changes that we've seen. I opened my practice in 2004. And so there's been a lot of change that's happened since that time. So thank you so much. I'm honored to be a part of this A4M webinar that's hosted by Human, especially following up from this Women's Health Summit. You know, we're standing at such a pivotal moment in women's health. You know, the FDA just removed the black box warning for testosterone therapy, and I believe it's more than just a regulatory update. I think it's an opportunity for us to redefine the standard of care for women. And I can't tell you how excited I am to be here and kind of kick that off with you guys. If you're new to prescribing hormone replacement therapy, I'm going to say welcome and congratulations. You've entered one of the most rewarding but complex areas of medicine. Women's physiology is dynamic, is interconnected, and it's deeply influenced by environment and by lifestyle. And so we're going to talk a lot about that today. I would say that my best advice to you is never stop learning. You know, A4M offers a tremendous opportunity with modules 1 through 5. I think that should be your foundation for learning if you're going to prescribe hormone replacement therapy, if not modules 1 through 8. And then I firmly believe in joining a mentorship group or getting a one-on-one mentor, whatever you need to help you learn from experienced clinicians. Guys, this is going to help you navigate not just the science of hormones, but helping women truly heal. I know when I first started my practice in 2004, we just didn't have these resources. But I was so blessed that I was paired with a pharmacist that was compounding bioidentical hormone replacement therapy. She was in a different state from me, but we would get on the phone and we would review cases and we would discuss, okay, how are we going to dose these hormones? And then we would follow up. Her help was just so important for me. And then I got in a mentorship group with an OBGYN, also in another state from me, because we just didn't have these resources sitting in Jackson, Mississippi. And I would not be the clinician that I am today. I can still hear their voice in my head, giving me all that advice on working with women. We have to recognize that dealing with hormones for females is not about chasing the numbers. It's really about developing a system and understanding that restoring balance is going to create longevity and healthgevity for them. So when it comes to the conversation on bioidentical hormone replacement therapy, oftentimes women are coming into you and they're wanting to know, am I low on estrogen? Am I low on progesterone? Do I need to be adding testosterone? But quite honestly, we as clinicians have to control the conversation. And that conversation should always start with safety. And that means, safety means understanding their terrain, understanding their liver detox pathways, understanding their thyroid health, their adrenal function, blood sugar stability, inflammation levels, and their cardiovascular health. So, one question you want to ask yourself when you're considering hormone replacement therapy for a female is this woman's physiology ready to receive those hormones? If her system is inflamed, if it's overloaded with toxins, even prescribing bioidentical hormones can create imbalances. So safety is built through systems, not from guesswork. The
That's
second
right.
thing I would consider is true balance. And balance is not about a ratio, it's about harmony. Hormones don't work in isolation. They interact with neurotransmitters, they interact with your mitochondria, they interact with your immune messengers. And so when we think about balance, balance is not the absence of change, it's the harmony, and it's allowing their system to adapt. And our goal when we're helping these women is to really get them back to adaptability. Can they create resilience? Can they bounce back from a stressor that their body's having to endure? And I think that's where many people struggle as practitioners. I know in the early days, I played a lot of dodgeball with patients or whack-a-mole, treating symptoms, not really understanding that adjusting dosage can only get you so far, right? We have to really work on the terrain. And honestly, I learned that the hard way. I would say my first few years in practice, not really understanding how important gut health, how important their immune system was, how important their cardiovascular system was to creating true balance. You guys are going to get to meet Lori Esarey later, but Lori and I teamed up early in our career. We met at A4M, and we decided early on that we were going to develop a curriculum together. And that curriculum is like a lifestyle companion for our patients. And this is how it works. When we have a patient that comes in and we're working with them on lifestyle changes, they have emails, they have an app that they can access that really teaches them daily habits on nutrition, on movement, on detox support, and regulating their nervous system. Because what we realized through years of practice was that if they did not have that companion with them, teaching them these things on a daily basis or a weekly basis, in between visits, they would get lost in the sauce. And it was like we were having the same conversations over and over. So what we found through curriculum was we found that we could gain a lot of ground even in between visits if they had that information. So we're going to share more about that curriculum in a little bit. But what we recognize that hormones can't do their job if their system is chronically inflamed. So we realized that prescribing the right hormone is important, obviously. But what we realized was that education created empowerment and it created engagement so that when they came in for those appointments, we could really gain some ground. So here's the truth that we've learned over and over again. You can't balance hormones in someone that's inflamed or in someone that's oxygen deprived. So inflammation and poor vascular health are silent sabotagers of hormone therapy. So write that down. Inflammation and poor vascular health. Um, those two things change receptor sensitivity, they block detoxification, and they accelerate aging. And so that's where nitric oxide kind of plays a role. And this was something that I did not learn until many years into practice. I mentioned several years I learned about gut health and how that was important for hormone balance. And then several years later, I learned the role that nitric oxide played. I thought that nitric oxide was important for males. We thought about erectile dysfunction, and I was using it all the time in my male patients, not really realizing that the same physiology, that decrease in nitric oxide that happens after age 40 for men also happens after age 40 for females. And if we don't have proper blood flow, we're not getting those hormones to the receptor site so that they can have the amazing actions. The other thing is endothelial function is important. The way those blood vessels contract and release. Mitochondrial health is dictated by nitric oxide balance. And also, nitric oxide worked as an anti-inflammatory and also as an antioxidant. So again, going back to cardiovascular health, that's something that we always want to make sure that we're looking at for our females. For females, cardiovascular risk are pretty high. You know, it's one of the silent killers for females, just like it is for men. So we want to make sure we're assessing that as part of their workup, not just prescribing hormones. In other words, hormones can't heal what they can't reach. And nitric oxide keeps that communication, those highways open. And that's why I truly value what Joelle's doing and what Human is doing by pushing this message forward and giving us the opportunity to meet today. Um, so just remember, we're not slowing down aging by chasing youth. And a lot of patients that are coming into you wanting these hormones, they're looking back. They're wanting to go back to age 30. We can't really do that. But what we can do is we can reduce those fires. We can control for inflammation. We can replace nitric oxide so that the foundation for safe and effective hormone replacement therapy can be there. So once safety and inflammation and vascular health are addressed, you know, we can really start thinking about, I think, the most fun thing, which is regeneration and restoration. Hormones are not merely replacements, they're cellular communicators. And so as we get them hormonally balanced, just remember their ability to internally communicate improves dramatically, and we're accelerating their body's own ability to repair. And you know, when I started my clinic, we had so much coming at us that we could be implementing all the different things, and it's no different today. I mean, peptides are all about and there were so many decisions to make about what did I want to implement in my practice. And one of the stances that I took early on, one of the lenses that I look through when I'm going to implement something is this regenerative? Is this going to help the body regenerate itself? And as long as I'm looking through that lens, then the decisions I make become a lot easier as to what I'm going to implement in the practice. And it's just saved me a lot of heartache and a lot of not chasing the next shiny object. So just something to think about as you're developing your own practice. I do believe that if women can understand that sleep, nutrition, blood sugar stability, and mindset influence hormone signals, they can become a true partner with you in their health care. And again, that's why Lori and I developed that curriculum, is going back to how can we help them understand the foundation of what they need to know? How can we give them a roadmap that's going to help guide them in between visits? So remember that regeneration happens when hormones, nutrients, circulation, and nervous system all work in synchrony. The art of hormone balance is all about restoration, communication, not just correcting the labs. So I'm going to turn it over to Lori Esarey now, and I get the privilege of giving her a little brief introduction. I know that Joelle introduced her earlier, and she is a force to be reckoned with in the villages. She is also my best friend and my partner in Synergy, and that's a company that she and I have developed together, again, to create curriculum. We also have a podcast that we host where we have other functional providers on to kind of share their message for hope and healing. And it's an honor and privilege to have her here today. And she's going to dig in and talk a little bit more about metabolic health and how we can bridge the gap, and digging into some of those concepts that I briefly mentioned earlier.
Well, thank you so much. I guess it would be great for me to come off of mute, right? I just want to make sure that you can see my screen, but I think that it's not advancing for me. So actually, I'm going to have you share instead. If you would do that for me, that would be great. I would appreciate it. Can you do that, Joelle? I don't see it yet. Do you? Nope. Do you guys, are you able to hear me? Yeah. Okay, cool.
Yes.
Awesome. Well, while
Sorry
Joelle is,
about that, Lori.
that's okay. That's okay.
I am trying to share my screen.
Okay.
It says I am screen sharing, but then since you can't see it, I'm guessing you can't.
Oh. Well, let me
Uh,
see if I'll be able to do it again. And if I can, we'll do it this way. I love Zoom, so we'll get back to this. No worries. Let's see if I can do it now.
ah,
Or was I able to get it?
yes, thank you.
Yeah.
Thank you. Sorry, Lori. I had it
Problem.
all
It's
queued up.
good. It's good. It's good. Well, listen, it's such a privilege. I can't honestly, yes, I have to reiterate what Kelly said. I am so grateful to have known Joelle for a very, very long time. She was very instrumental even in my journey getting into functional and integrative medicine. Between her and Tammy Holland, who is another dear friend of mine, like I am here today as a result of them just giving me that nudge. To look at medicine differently. I had this yearning, but I didn't know where to go. And they were just giving me those nuggets. So, hats off to you and just for all that you've done and for having us here today. And then to you, Kelly, thanks for serving it right up. I think one of the things that Kelly said today that I want to dig deeper in, I'm the science nerd. I love science. And I get a chance to talk a little bit about my baby, which is the relationship between insulin resistance and hormone balance. And she said something very clear, and I wanted you all to hear it again, is that, the terrain, you have to understand your terrain. We're not correcting for labs. We're metabolically balancing a patient. And so my goal in this over the next couple of minutes is to help you bridge the gap, truly looking at metabolic foundations and hormone optimization. Hormone balance is rarely primary. So you guys might just be getting into this. You might have been in this for a very long time, but I'm going to tell you this, it's rarely primary. It's usually secondary to metabolic chaos. I like to say the patients that I treat and love to treat are metabolic messes. They're just messes. And so the following four mechanisms: insulin resistance, inflammation, you've heard it a lot. You're going to hear it a lot today again, oxidative stress, and mitochondrial dysfunction. They both precede and they perpetuate sex hormone dysfunction. They create a vicious cycle. So we're going to go through some objectives real quick. We're going to highlight how metabolic dysfunction drives hormone imbalance. We're going to address some cardiovascular risks of under and over treatment because it can be both. We're going to talk about oxidative stress and cellular as a cellular sabotager. And we're going to introduce nitric oxide and the glycocalyc support as part of the clinical foundation and the power of your mitochondria. All right, so it's not going to let me advance. There it is. So before hormone balance, please don't forget there must be metabolic balance. Before you actually hormone balance anyone, there has to be metabolic balance. You see, hormone imbalances don't appear out of nowhere, do they? They don't. They don't appear out of nowhere. They're downstream of metabolic dysfunction. And as I said earlier, that insulin resistance, inflammation, oxidative stress, mitochondrial dysfunction, they all precede and they perpetuate. So here's a quote for you. I want you to remember it. I hope you have your favorite writing utensil and paper to write this down. If we modulate before we restore, we create a very fragile balance.
Mm.
Sorry about that. All right. So insulin resistance, I am gonna, hopefully you leave out of here today with a few nuggets. And part of those few nuggets are this very important concept that insulin resistance is ground zero to hormone chaos. It truly, truly is. You see high insulin, low sex hormone binding globulin equals more circulating estrogen and testosterone. That's estrogen dominant. So we get the fluffy midsection, right? And we get that androgen excess. And then we have it altering ovarian and adrenal signaling, which what? It makes people cranky, hot, sweaty, moody. We say itchy, bitchy, moody, right? All of those things. You've heard that before. In men, because we have to talk about the men too, because I know this is about women, but at the end of the day, we have men in our lives. And in men, we see that increasing aromatase, that lowering of testosterone, and that increasing of estrogen. So they get those man boobs and they start crying at those not so sad movies. A little clinical pearl for you is that insulin resistance, again, often precedes menopausal hormonal changes by what? A decade. A decade. So please don't forget that. That's why things start happening real, real early. So, chronic inflammation, Kelly said it. I'm just going to reiterate it. Chronic inflammation is the signal jammer. Inflammation blocks hormone communication. Cytokines, circulating cytokines, they blunt that LH, FSH signaling. So, normal labs, right? Normal labs, but very, very poor tissue response. Low estrogen removes all of that anti-inflammatory protection. So remember, the lower a person's estrogen is, they don't have a lot of that anti-inflammatory protection. So you're going to see those inflammatory markers on those labs go up as estrogen lowers. So as you're watching those labs, so those are some of those byproduct labs, those other labs that you're looking at that you'll start seeing as trends again, decades ahead. So you just got to kind of look earlier, right? It drives that endothelial injury. And that's one of the things, again, that Kelly spoke of is that it drives that endothelial injury as we know it, and it increases that cardiovascular risk. So, a key phrase here, because I want to leave you with these key phrases, is inflammation is the static in the hormone conversation. Say that again. Inflammation is the static in the hormone conversation. So, you got to decrease the static if you're going to get the outcomes that you want. All right, so how does this all relate? And the heart of the matter. The heart of the matter is hormones and your cardiovascular health. So on that left-hand side of the screen, you see this low hormones that are left untreated. What happens? You have a lowering of nitric oxide. What happens when you have a lowering of nitric oxide? You get stiff, hard blood vessels. Can't get that blood circulating very well. In addition to that, you get an increase of visceral fat. When visceral fat is high, none of your hormones, that is basically it's a storage tank for your toxins, right? That's where your toxins lie. But at the end of the day, all of that visceral fat completely, again, creates the static in the conversation of hormones. You're not going to get hormone balance. So the higher you have that visceral fat, it's going to be harder and harder and harder to manage hormones. Because with that visceral fat that goes up, one of the other things that we see all the time is insulin resistance. So if you guys are doing in-bodies, and I really encourage you to do some form of body composition in your clinics. If you have not initiated that yet, I do feel like that's one of the things that has been very instrumental in my clinic since the start is really understanding it's not about weight on the scale. It truly is about what comprises weight, right? It's, how much lean body mass do they have? How much body fat do they have? It's that intracellular, extracellular water. So that visceral fat definitely does create muddy waters and increased insulin resistance. And overtreatment of hormones without the foundation. And you're going to hear the foundation in a bit because Danny's going to talk about all about the foundation, right? What we eat, what we drink, how we sleep, how we move, how we think, those things. If you do not manage the foundation and gut health, you will never manage hormones. In fact, you heard Kelly say it, you can actually create more risk and will create more risk. So again, it's you really looking at what you've got, how the terrain looks. So over-treated without the foundation, you're going to have increased oxidative stress, which what does that do? It accelerates aging, increased inflammation, and clotting risk. Clotting risk. All right, so oxidative stress, accelerated aging. I don't know anybody here today that probably that wants to have accelerated aging, right? We want to slow down the aging process. We want to optimize our overall health and well-being, but oxidative stress It is a cellular sabotager. Oxidative stress damages your hormone machinery. Free radicals, right? Free radicals oxidize cholesterol and they lower your hormone substrate. And it damages the receptors, right? Those receptors are like lock and key, lock and key. And when you don't have those receptors that are healthy receptors, unfortunately, hormone chaos happens. So we want to make sure that we have really cleaned up and healthy hormone receptors so that we can signal properly. And then with oxidative stress comes a loss of both estrogen and testosterone. Actually, all of your hormones become completely disrupted. Remember, those are downstream to other hormones upstream, right? So you have the adrenal hormones, you have thyroid, you have all of that. These are downstream and it messes it all up. So loss of that estrogen, testosterone equals a loss of antioxidant protection. And that becomes a vicious cycle. Again, increasing one's risk of all kinds of things, but as a personal breast cancer survivor, I can tell you that this is part of the story. Insulin resistance is a big part of the story. Oxidative stress is a big part of that story. And then you have the bridge to nitric oxide. Here you go. Bridge to nitric oxide. Oxidative stress depletes nitric oxide, as I talked about earlier, and it injures that glycocalyx. And that ties into what? Vascular aging. So, no good. No good. And then nitric oxide, which is the bridge we talk about between metabolism, vascular, and hormone health. You see, nitric oxide is the language of your vascular health. It regulates blood flow. As Kelly said, you got to get the delivery system there, right? So you've got to get it all there. So it regulates that blood flow. It regulates oxygen delivery. It regulates your mitochondrial efficiency, which is the powerhouse of your cells. It also regulates hormone receptor sensitivity. Again, you need those hormones and those receptors to be sensitive. Estrogen and progesterone naturally stimulate nitric oxide synthase. One reason women's cardiovascular risk skyrockets when all of these hormones decline. And when oxidative stress and inflammation, both depleting nitric oxide, that is when endothelial dysfunction follows. Hard, stiff blood vessels, inflammation leads to sticky blood, increased fibrinogen. That is the perfect storm. We don't want that. So, supporting nitric oxide through nutrition, through movement, and tools like Neo 40, excellent way. That's a great tool in the toolbox to help restore that vital communication bridge. You see, here you have to know that you cannot make hormones without mitochondrial power. That's the powerhouse of your cells, right? We need mitochondrial power. We need to feel like that, feel that energy. So steroidogenesis starts in the mitochondria, the powerhouse of the cell. This one's your body's way of dropping a major truth bomb. It's saying, if my mitochondria aren't happy, my hormones aren't going to be either. So when inflammation, toxins, or nutrient shortages are present, your cells are not going to make enough ATP, which that's energy, right, to fuel your activity. And I don't know about you, but I want to be able to get up every morning and do the things I want to do. If I want to take that 10-mile walk on the beach, I want to do that. And we're not going to be able to do that if we don't have ATP, if we don't have that ability to turn energy. And without healthy mitochondria, you're not going to have that. So that deficit that happens really reduces your body's ability to produce hormones efficiently. So it's basically the body saying, I don't have the energy to keep up with hormone production right now. So we've got to really focus on those mitochondria, mitochondrial health. So when hormone levels decline, like estrogen, progesterone, or testosterone, that's why this work is so important that you're doing, helping people balance hormones, right? It's not really necessarily replacing as much as it is working with people to balance. It's the symphony of those hormones. And when that doesn't happen, your body's ability to create these new mitochondria, they can't do it. So in other words, your body is saying here, when hormones fall, my energy tanks too. It's kind of a double whammy at that point, right? So here is the conclusion, and I really hope that today one thing I want to leave you with is understanding that metabolic dysfunction equals hormone dysfunction. Metabolic dysfunction, any disturbance in your metabolism is going to affect your hormone dysfunction. And one of the primary drivers of that is insulin resistance, inflammation, oxidative stress. This is a loop. It's not a line. Each of these dysfunctions fuel the next. Nitric oxide and endothelial health, they sit at the intersection of metabolism and hormones. So, a little clinician call out here, we can't fix what we don't first stabilize. We can't fix it if we don't stabilize it. So, before we adjust a single hormone, we must repair the metabolic terrain. So, Danny, I'm going to turn it over to Danny right here. She's going to walk us through how to do just that. And if you don't know Danny, you need to know Danny. She is one of the sweetest people I know, has a amazing sense of humor. I love every time I get a chance to be around you. You just increase my happy hormones to be around you, Danny. But Danny's just a wealth of information. She's written a book. If you haven't read it yet, you need to. And off to Danny. Thank you so much for allowing me again, Joelle, to talk today. And I can't wait for this next part. And I'll be here for questions at the end as well.
All right. Well, thank you, Lori. You teed that up fantastic for me to talk about the foundation, right? The common sense practical medicine. And she mentioned inflammation a lot. And I have an entire chapter in the book titled Inflammation is the Devil. And it is. It is the root of 100% of all chronic lifestyle diseases. And it's very rare that we can say all. Lori and Kelly know this in medicine, or you can say always. But inflammation is the root of all chronic lifestyle diseases. What are chronic lifestyle diseases? Well, you know that. Diseases you weren't born with, diseases you turn on, things like high blood pressure, high cholesterol, right? Lupus for me, irritable bowel syndrome, depression, anxiety, IBS. I mean, the list goes on and on. Hashimoto's thyroiditis. Most people are born healthy. And I am living proof after 24 years of seeing doctors. If you were born healthy, you do not have to live sick. And it took 24 years and 10 doctors before a doctor ever leaned into me and said, Danny, what are you eating? Don't you know your diet controls your symptoms? And it changed the entire trajectory of my life. I hope my children's lives, and so far thousands of patients' lives, the whole trajectory. And just like you get an opportunity. We are blessed every day to get to change the trajectory of our patients' lives, but the next generation. And what I do with my patients is I work on first decreasing inflammation, right? Starting at the root cause. Most of the time, it's an inflammatory response in the gut, a leaky gut, or it could be something else. And I wrote the book on 6 steps to healing, common sense steps to radical healing. And that's what I'm a lot of things. I'm not a science geek like Lori is, but I have got more common sense than a lot of people do. And so these are my 6 steps, and we're going to briefly touch on these a few minutes each, that we have to get in order for us to help our patients optimize their hormones and their adrenals and their thyroids and their libido and things like that. They've got to eat well, sleep well, move well, poop well, de-stress well, and commune well. And it's not rocket science. And someone asked on here, can you, the name of the book is Wild and Well. It's everywhere you buy books online. But somebody said, is it better to do a metabolic detox first? That's what I do with my patients first. When I'm meeting with them, I do a 10-day anti-inflammatory phase 1, 2, 3 liver detox. We don't make it, human doesn't make a 10-day detox. So I can say that I use, can I say the detox I use, Joelle? Okay. Yeah. So I use the Metagenics detox. We private label it, but it's 10 days. I do an anti-inflammatory Mediterranean diet detox for 10 days with every single patient that will do it. That's what I did. Decreasing inflammation, removing the gluten, the dairy, the soy, the corn, the sugar, the eggs, and the peanuts. Those are the top 7 inflammatory foods in the United States. If you didn't know, dairy's number 1, all dairy, yogurt, ice cream, butter, cottage cheese, cream cheese, half and half, milk, cheese. Dairy's the number 1 food sensitivity, and eggs are number 2. And patients gloss over when I ask them to remove these. Am I right, ladies? They absolutely, yes. Well, what are we going to eat? Well, there are hundreds of foods for us to eat that do not cause inflammation. And again, that's the whole key to my practice and to their practice, and hopefully yours, is to bring down inflammation in these patients. So I remove those foods. We do a 10-day, 21-day, 28-day, whatever we need to do, elimination, while we're waiting on their food sensitivity results to come back. And that's key for me with my patients. And I teach them that cooking is self-care. Cooking can help optimize your hormones as well, right? Cooking will heal you. I'm sorry, food will heal you or kill you. I suppose cooking could heal you or kill you as well, but your diet will heal you or kill you. It is as simple as that. And so we are working on the first 31 days decreasing inflammation in the body, and they come back feeling so much better, because let me tell you something. It's way easier to work on hormones and adrenals and thyroid and all that than it is to ask them to change their diet. We are so emotionally connected to food, it's not even funny. You don't ever have to drink a glass of alcohol again. You don't have to ever smoke a cigarette again or do drugs again, but you have to eat. And we are very emotional about it. And I have found that the women and the men who do the best at what I do, at what I ask them to do, they take the emotion out of it. They eat to live instead of live to eat. And it's not easy, but it's very simple, but it's not easy. So that's what I do, the very first step to get them to eat well. The older I get, I think that sleeping well is equally as important as eating well. And I don't know if you all agree with that or not, but if you don't sleep well at night, if you have trouble going to sleep, staying asleep, if you're snoring, if your partner is snoring, if you have two dogs in the bed and a cat on your head, I mean, and your computer's in there, your TV's in there, you know, the bed is for sleep and sex. That's it. If you're not doing one or the other, get out of it. Get your patients out of that bed. And I tell people, you don't have to sleep all night. Nobody slept all night. I don't know where that came from, but prior to the Industrial Revolution, people didn't sleep all night. They got up in the middle of the night. They had sex. They stirred the beans. I don't know what they did. They read the Bible. They cooked. They did stuff. And then they went back to sleep. It was called first and second sleep. Telling our patients that they have to sleep all night is detrimental to their health. And it's about how you feel when you wake up in the morning. That's what I'm most concerned about, right? So you've got to eat well. You have to sleep well. And you know that I use the tart cherry. I know we're talking a lot about nitric oxide, but I use the tart cherry a lot with my patients at night, that human does, because it's got, oh gosh, I just went blank, 500 or 1,000 milligrams of tart cherry in two chews. I don't remember, Joelle's on mute, but it helps you sleep beautifully at night. And so we've got to get that bedroom ready for sleep and get their sleep hygiene in order. It's key to bring down inflammation. It's key to optimize those hormones. It's key for them to be able to eat well. And then you've got to move well, because if you don't eat well and sleep well, you'll never move well. And it works from, you know, from moving well as well. If you don't move well, you're not going to sleep well and you're not going to eat well. We've got to exercise. And I don't care what you do. I tell my patients, doesn't matter to me if you hula hoop. I have a professional hula hoop that was a patient of mine, a hula hooper. If you ballroom dance, I don't care if you rollerblade or what. You've got to move your body. Jack LaLanne, I wrote a whole chapter in here on Jack LaLanne, which if you're old, you know Jack LaLanne. He was the best. He said, white sugar, white flour, white dairy's killing us. All you need is to push up, sit up, jumping jacks, planks. I mean, it's basic stuff. You don't have, Joelle, you know this better than anybody. You don't have to have fancy stuff to work out, right?
That's right.
That's exactly right. So you've got to move your body. They've got to move. And that's going to help with their inflammatory response. And it's going to help with their hormones as well. And everybody feels friskier when they work out. And so people that know me know I talk a whole lot about libido. It's not on here, but it's a huge piece of what I do and how I use nitric oxide as well with my patients. But you've got to eat well. You've got to teach them to sleep well, move well, poop well. And this is imperative. And these are all questions I'm asking each patient, as I know you all are as well. How often do you poop? What does it look like? I have a gigantic poster in my office of the Bristol stool chart. Everybody's got this beautiful artwork in their office, and I've got a bunch of poop, 1 through 6, on my wall. And I ask every single one of them, how do you poop? What's it look like? You know, and the kids love it. The teenagers love it and stuff, but they've got to poop. And I tell them, look, if you've got a healthcare provider who tells you it's okay to poop twice a week, you need a new healthcare provider. You are creating chronic, systemic inflammation if you don't have multiple bowel movements a day. And how do we do that? Hydration. Dehydration is a huge reason for constipation. Magnesium, things like that I have them get a squatty potty, right? Hot tea. I mean, all things like this that are going to help them eliminate regularly. And it's key. I mean, it's so interesting because if you don't poop well, you don't want to move. Many people don't sleep. They don't eat. Eat well. It's all connected. And one of the biggest ones, especially since COVID, has been the de-stress well. You know, I see probably 99% women and then 1% men in my clinic. And these women are so stressed. They have no margin in their life, just like us. Right. And no margin. There's no room for error in their life. And they're irritable. They're angry. They are overcommitted, you know, underpaid. They're miserable in their jobs. They're not happy in their marriage. I ask every single patient, did you marry the love of your life? Do you want to stay married to him forever? Because I'm going to tell you guys, if any of you are new at this, if you are seeing women and men and they're in a miserable marriage at home, you can only get them so far. There is no price tag for peace. You can't get them optimal if they are living in chaos at home. And so I talk long and hard to them about their marriage and about talking to their spouse and maybe therapy, but de-stressing well, I tell women, you know, maybe you're the head of the household, maybe you're not, but you set the tone for the entire home the minute you walk through that door. Whatever mood mom is in, or the wife or the girlfriend is in, the entire family is in that mood. And it's very complicated to ask people, or they may think it's very complicated to ask people to automate, eliminate, and delegate everything they can out of their life. AED, your life. You know, our automatic external defibrillators, right? That bring you back to life. That's what I ask patients to do. Automate everything they can, eliminate everything they can. Thanksgiving's coming up in a few weeks. Guess what? If you don't want to host Thanksgiving at your house this year, then you send out a text message to your family and you say, right now, I'm sorry, I can't do that this year. We have the right to do that. As women, many times we overcommit. We stress over things that, you know what, if I didn't want to do this webinar today with you all, I would have said no. Joelle, I appreciate the opportunity, but you know what? I'm up to hearing commitments. There's nothing wrong with saying no. And maybe somebody on here just needs to hear this and has nothing to do with inflammation and your patients. But I'm telling you, the faster you and your patients learn how to set boundaries and say no kindly, the faster they're going to bring down inflammation and things are going to start to get better in their body. And they're going to start to reverse decades of chronic lifestyle diseases. And then you have to connect well. You have to commune well. It's key. You know, I'm a huge fan of community. I'm a big fan of Jesus. Jesus loved community. He loved community and he knew how important community is. And, you know, lack of community, loneliness, that creates inflammation in our bodies. When you're laughing, when you're with your people, you decrease inflammation in your body, you decrease cortisol in your body, and you boost your immune system. So community is key, and we are so lonely. And there's proof of that with the suicide rates going through the roof. And the fastest growing rate of suicide is age 10 to 13 in the United States. That is a community epidemic, a mental health epidemic we have going on here. And so with my patients, this is how I start, is starting with these foundations and trying to bring down inflammation fast. I use Neo 40 with my patients for lots of things, for cardiovascular, all the things that Kelly and Lori talked about. But really, a big one is for libido for me. And I tell my patients, I'm getting older. I'll be 60 in January. And so my patients are getting older and their husbands are getting older too. And we know what happens oftentimes as men get older, things don't work as well. And I tell them, if there's a blood flow problem to the penis, there's a blood flow problem to the brain, and we need to get them, get their circulation going and get those vessels and arteries and capillaries opened up and that blood flow going through there. And that's how I do it. I don't know if it's right. I don't know if it's wrong, but that's how I work with patients every single day. And another tip that I have that many of you, if some of you are new to this, is I got 90% of my chronic diseases better when I addressed these things in my own health. But I didn't take it to the next level until I addressed the chronic childhood trauma that was in my life. And once I learned about childhood trauma and how to address that head on, and I started working on that with patients, my patients have done better the last 8 years that I have really studied trauma than they did the first 8 years before, because I didn't know. You don't know what you don't know. But addressing the trauma is key to me. I don't know if Kelly and Lori address a lot of childhood trauma, but it has been imperative. Do you agree, Lori?
Absolutely. We were just talking about that today at lunch, Kelly and I think that much like Alzheimer's or early cognitive decline or even ED, it was one of those conversations that working in internal medicine before, it was like, oh, I didn't want to have that conversation, right? Is how do we as clinicians, though, recognize that it's non-negotiable. We have to have these conversations with them, and trauma is on that list. We
You
just have
bet.
to figure out how to enter into that conversation and being sensitive to at what point they're ready, and having people in our community, back to what you just said, in our community that we can punt to
You bet.
assist them in that work.
So what I do now the past 8 years is on their new patient paperwork that they fill out at home, we give the ACE questionnaire. It's in, so they can do it in the safety of their home, the Adverse Childhood Experience Questionnaire, and they fill that out. I also have it in the book actually, but they fill that out at home. They send that back. So if they don't know what that was, then they're aware of it now, and they may do a little research on that. But what I find, because Hashimoto's thyroiditis is my specialty in my clinic, is that many of my women, and I'm so sad the first 9 years that I did this, 8 years, and I didn't know this, this is your voice. This is your fifth chakra right here. Many of my Hashimoto's patients, well, they have huge childhood trauma scores because as a child, they had no voice. And so they lost their thyroid, either to cancer, to nodules, to Hashimoto's thyroiditis, or hypothyroidism. It's fascinating. My trauma did not manifest in the thyroid. It manifested in the gut, in the root right here is how my trauma manifested itself. But the trauma is key. And I agree, Kelly, the trauma is key to this. So something that Kelly said, or Lord, yeah, Kelly said earlier, is find a mentor. If you're working with hormones, if you're brand new to hormones, and y'all can let us know if you are new to hormones, just put it in the chat. I had a compound pharmacist take me under his wing 15 years ago and taught me everything that he knew about hormones and how to do that, because it is nuanced. There's 24 of you on here. All 24 of you will have something different prescribed to you if you're working with a functional medicine provider who understands hormones and the nuances of it. And so that was key to me, to learn from a compounding pharmacist and somebody who took me in. And ask, if you don't have someone, ask someone that you admire in the community to help you. But there's many ways to prescribe hormones. There's many things to do. But if you don't address the inflammation and the root cause and the common sense things first, you will never get their hormones optimal. And I think that that's what all three of us do very well, is really dig to the root cause of our patients' issues. So I know my 20 minutes are up. I had other things to say, but I appreciate this more than you'll ever know. And if you're new to this, man, just start with one thing and just learn one thing very well and move on from there, because you'll never learn it all. Am I right about this, Lori and Kelly? We never know it all, ever. I'm learning something new every day.
Very true. Thank you, Danny. I have to tell you that what changed, it also changed the trajectory of my life, was getting to a functional medicine doctor. And that term wasn't even used in the early 90s,
Right.
really. And she had me do Danny's 6 steps to common sense radical healing. 6, it was amazing. As she went through those, I was like, yep. And I felt better in a month than I had my whole life. My
That's
whole
right.
life.
That's right. And
Yeah.
men are so much easier to work with for me. They are so much easier because I give them a list, 10 days, 21 days. Here's what I want, blah, blah, blah. I've got a whole list of videos, all the things to do. It's a big list. They get a big notebook. Men are so great. They come back, they love a list. They've checked off everything. They're 20 pounds lighter, all the things, right? And I said, well, what did you do? How did you do that? And they bring their notebook back, which most women don't. I tell them, bring your notebook back, we'll fill it up. So they go, oh, I just followed your list. Gosh, we are so emotional about things as women that it's harder for us to just go down a list. But men are better. I don't know if y'all noticed that or not, but oftentimes men are more compliant patients because they don't get tied up in the emotion of this. They
I
just
think
know
for
better.
females, would you agree, Danny, that most of our females are too busy taking care of everyone else?
You bet.
Right?
You bet.
And
when I
men can be
say,
like really focused on themselves and
that's
nobody
right.
else matters.
That's right. You're
And
right.
I do think there's more nuance with females. We're more interconnected, metabolically
Yes.
speaking, and it's harder oftentimes to move the needle, especially when there is chronic inflammation and trauma associated with. And so, yeah, men are so much easier to navigate than women oftentimes. But here we are, right? Here we are.
Here we
We
are.
are. I would have never
We're
guessed that in a million years.
Oh,
Well,
so
I think that well, the other thing that I see, and I don't know if you all see this, but they can be really quick out of the gate, and they can be very good at following the rules. The problem with them is they often run out of the stamina, right? And they need the wife in their life to be on this journey with them, to be motivating as a family. And I do think there's a lot of power in couples walking this out
you
together.
bet there
yes.
is. I try to detox the couple together. So I always say, well, would your husband do this? Does he need some metabolic, a little bit of metabolic boost over here? And oh yeah, yeah. And then the couples who detox together stay together, and yeah. And then, but
Yeah.
the men will lose 20 pounds and the woman comes back 2 pounds maybe lighter. And they're like, oh my gosh, this is ridiculous, but it's okay.
Yeah.
We're working on the
We're in it for the
inflammation.
long game,
I
not
tell
the
women,
short game.
look, it took you 5 decades to get into this shape. It's going to take you longer than 5 weeks to reverse this. And that's something that I think our patients forget. And maybe we forget to tell them. Sometimes I do. This is a marathon. This is like an ultra marathon for the rest of your life. And I say to them too, look, I know what it's like to be sick and I know what it's like to be healthy. And there's not enough gluten in the world and dairy to make me go back to how I felt 15 years ago. I'm not doing it. I feel better now at 59 than I ever felt at 49 or 39. And I'm just not doing it. And I do think as healthcare providers, and then I'll shut up, we have to walk the walk, ladies and gentlemen. We have to walk the walk. If we're asking our patients to eat well, sleep well, move well, poop well, de-stress well, commune well, then we better be doing it also, because they're watching us. They're watching us in the community. They're watching us at restaurants. They're looking in your grocery cart when you run into them at the grocery. They are taking notice of what we're doing, and we have to walk the walk.
And I agree in saying that too for the newer providers on here. It's not about perfection. It's
Right.
about progress. you're
That's
gonna have
right.
setbacks, right? You're gonna learn there are
Mhm.
nuances, and give yourself the grace to do that.
That's
But
right.
you've got to be actively in pursuit of living well and
That's
learning
right.
and applying. And when you're transparent with them too, that you're on this journey too, they appreciate.
Yes.
And we were not taught that in medicine. We were told they're sick, treat them, don't be transparent. And the reality is there is a time and place, obviously, not to share all of your stories. I mean, there is a fine line, but in that, I do believe that they truly enjoy getting to know you a little bit and what your struggles have been, what you have been through. Like, I'm sure you share your trauma story to an extent of just the fact that you had to do that work, right? You
Mhm.
had to do that work and you
You
shared that.
bet.
So
You bet.
they need that. They need that. I did want to go back to something that you said about mentorship because I know that we've said it now a couple of times, but I would tell anyone who's listening to this, it is extremely important to be around people. You are the average of the five people you hang around the most. If you want to excel at anything, you get around people that are doing it well. Lean into that. Ask
Mhm.
questions. It's okay. Ask a lot of questions. Be kind of annoying. It's okay. Like,
Bet.
call them up, ask those pharmacists. And not only are the prescriptions different from person to person in person, but you're going to find that the testing is also different. If you ask
Yes.
one person what they use to test, you ask someone else, it's going to be different. So it's going to be really, really important to have people around you that you're challenging, that you're digging into the research, you're
Mhm.
applying things, and you're asking really key questions. Kelly and I love, we have a mastermind group that meets once a month, 9 months out of the year, just for this. It's just a mini, provider coach exchange where we have case studies. And we learn so much from each other just in sharing those case studies. Like,
Mhm.
that's a great way to connect and learn and challenge each other.
That's exactly right.
Yep.
Yeah,
So, Lori, is that something you and Kelly run?
we do. We do. Yes. Mhm.
Okay.
Yeah.
Is it on the slide that I'm going to show here?
Yep. So
I
it's
wonder. Okay.
Yeah, so it is actually, they can contact Synergy Connect. And I can put that in the chat as well if
Okay. That'd be great.
joining something like that. We do it
Okay.
9 months out of the year because, of course, December is A4M and everyone's really busy that particular month. And then we take a couple of months off during the summer to honor recovery. It's again, we have to live that life too. We have to do what we preach. So taking some time for recovery. So 9 months out of the year, we do that. And it's typically on a Friday afternoon as well. So for those that are interested in doing that, I'll put that in the chat. They can send a message.
Great.
Yeah.
Yeah, as I mentioned earlier in my career, having that time for mentorship where I was involved actively as a participant was just so important. And so that's one of the things that Lori and I felt strongly about as our give back to the community, making ourselves accessible and available where people could come and present their cases and not feel judged. We also allow you to bring your team members. So if you have a health coach or someone that's really helping you navigate those plans of care, having them there too. Because I'll be honest, we learn a lot from our health coaches, a lot of resources, video content that they bring to the table that we would just wouldn't know about. Again, going back to community, we learn in community, we heal in community, and so really looking to support that. So we love having our time with our Synergy participants in that way. We also this year did something a little bit different, and we developed an app that is direct to consumer, and it also can be used by providers in their practice. So think of this like a Bible app, or think of it like something, a lifestyle companion that you can have in your pocket that teaches the foundation that we've talked about today. All the things that Danny talked about, all the things that Lori talked about, tucked away in written content, video content, gamified, to keep them really engaged in what you're asking them to do, because the foundation is the foundation is the foundation. And if we don't help them lay that solid foundation, all the work that you're doing in testing them and prescribing the best possible hormones can only go so far. And if they're not doing the work in between those visits, then oftentimes you're still playing dodgeball, you're still playing whack-a-mole, trying to treat their symptoms. And so we're really excited about having the app out there. And we do offer an affiliate program for providers that are wanting to use that app for their consumer. So we did offer you guys to have a 30-day free access to the app, and we want to hear your feedback. You know, we're building this. We have built it, but it's up for revision at any point. And so we're listening to what our consumers are saying, what they love, what they wish they had more of. And so we would appreciate you guys just using that QR code and trying it out for 30 days and telling us what you think.
And I want to just add that many of you have clinics. I know when I started, I didn't have, it was just me. It was me, and then I did hire someone to do, front desk and administrating and client care coordinating, and then it was just me and one other person. So I didn't have the ability to hire a coach, a health coach. So I had to figure out ways to bridge the gap between my visits because you only can do so much in the time that you have with them, whether that be a half an hour or an hour. I don't ever see a patient under an hour. That's just me. But even in that time, I didn't have a lot of time to cover the food nuances, what to eat. It can get kind of tricky, right? As you're doing food intolerance testing, or you're just honestly teaching them how to eat. So this app, we really built it also to bridge that gap between those visits, to aid you having that, for your patients to have a kind of coach in their pocket to do those things. And we talk throughout the entire app of how important it is to seek out a qualified healthcare practitioner, not just a healthcare practitioner, a qualified healthcare practitioner to align themselves with, to do the testing to keep them on that journey. So our goal in doing this really was to aid and bridge that gap for clinics too that just didn't have the ability to hire a health coach just yet. But even the ones that do, honestly, a lot of learning, it's kind of like how do, chiropractors, what do they tell you when you leave their office? They give you a treatment plan. They give you things to do between the visits. Same with physical therapy. They give you things to do between visits. The more your clients, your patients are leaning into learning between your visits, you're going to get
Mhm.
so much further, so much faster. So this is just another means of doing that. There's all kinds of other things out there. Books. I love book recommendations. They love book recommendations.
Yes.
Hand them Danny's book.
Yeah.
Challenge them when they get back. Did you read chapter whatever? What are you reading right now? Because
Or
that's
what was your favorite chapter in the book? That's how I always know if they read it or not, because then they just look at me like, what? Or any book, anything you would say, yeah, what was your favorite chapter? That's right. Book. We have a book list we hand out of our favorite books to them. They do love books. You were right about that.
Well, that's a good point too, is before you even begin, and I think Kelly and I would both agree, Danny, what you said is starting out with some form of detoxification and deloading is critical. It's setting the terrain, right? But after, you set that terrain, you're then doing other testing, whether it be gut microbiome or whatever. It's finding other ways to connect, whether it be that book or maybe podcasts. Some people are auditory. They want to listen. Kelly and I have a podcast as well. It's called The Synergy. It's GEE. Don't want to throw anybody off there, but it's the Synergy podcast. But we get an opportunity to talk to other people smarter than us in areas which I love, that have great things to offer and communicate. So yeah, all of those things are so helpful for clients in between visits to be listening and learning and growing, and for us to play to bring up, like you said, hold them accountable. What chapter did you like the most? What did
That's
you think
right.
of that podcast? What did you like about that? Mm-hmm.
Yeah. Yeah, but I want to say something real fast that happened to me today, and it's a real humbling experience for me. I messed up apparently with this patient. I got a message from her today that I'm looking at. It's very long. I won't read it, but she doesn't feel good, hasn't felt well for years. She was in tears last week with me, and I have done everything I can think of, and I'm working on mitochondria now. In fact, we did Neo 40. I did another supplement to build mitochondria things. But this is so interesting. I did food sensitivity testing on her years ago. Years ago. She's at a retreat or something right now, and she's doing a lot of praying. And she said that she said, the Lord showed me what my problem is, Danny. It's whey, WHEY. I tested positive for it when I did your food allergy test. I didn't know, Danny. Okay, goes on. Long story short, she had no idea that whey is dairy. So she's drinking a protein shake that's dairy, she had no clue that it was whey, or that has whey in it. Now we talk about dairy. I talk about all the things, but I never have talked to a patient. Well, I do, but not specifically about whey. I talk a lot about casein, but that whey. And so this woman, I hope, she said, I'm feeling better. 2 days, I've cut all whey out of my diet and I'm already feeling better. She did not know. So this is a big learning aha light bulb moment for me, is that holy cow, we do this all day, every day. And sometimes it slips through. They don't know. They do not know. It was like me trying to learn hormones at 44. I was clueless. I had no idea what any of this was. And man, that's a big deal. I messed up with her. I hope to goodness that's all that's wrong with her, is she's eating whey and the Lord told her, and there we go. And the Lord's better than me. There's only one perfect human, and clearly it wasn't me. But listen, that's a good teaching moment for all of us, is, man, when we say stuff, we have to really dumb it down.
Yes.
Dumb it down.
I would agree with that. I've been on several report of findings with doctors and friends who've asked me to listen in. And I was on one with a doctor who had done a advanced lipid test. Hour of a call, 1 hour call. He hangs up and my friend says, "What's a lipid?" So
Oh,
she missed everything on the call, because if you go by what Emmett Fox, who wrote Sermon on the Mount, he says, you don't know one word and you can't follow the rest of the conversation.
Mm-hmm.
And
that's
so
right.
that's really true about having to bring it down to a level that everyone can understand.
And so true. Lori
Yeah.
mentioned earlier that she spends an hour with her patients, and I do as well. And I think it's so important that we're not rushing them and that we're giving them time to ask their questions. Number one, to settle in, because they show
That's
up,
right.
they've been busy, they're running in, they've got 25 things on their mind, and it takes them a good few minutes to kind of just even settle into the conversation. And then we have the things that we want to say to them about their lab work, about what we're finding and what we're going to do next. But pausing and really giving them an opportunity to make sure that we're listening for those discrepancies in their understanding, giving them an opportunity to ask those questions and just being there with them. I think there's a tremendous value. And my team's come to me several times about, can we shorten their visits, and I'm like, no, because just as soon as I do that, I'm not giving them the time that they really need to get all of those questions answered and make sure we're giving them the space they need to truly feel heard and seen and heal.
Wonderful. Well,
Yeah.
I'm going to go to the chat in a minute, but before I do, to get questions for you all to answer, I just
Sure.
wanted to put our specials up. We have, many of you were at iLads or you were at A4M, the Women's Health Summit. So there's your codes for a discount. They are available through October 31st. I did got permission from our president to run a special for World Menopause Day, which happens to be tomorrow.
Oh,
This special
nice.
is, yeah, and it's only good for one day. So from midnight tonight to midnight tomorrow night, it's a 20% off discount. And the code is World Menopause Day. So please take advantage of that. I'm sorry if you're listening to the recording and that day has passed, but we're celebrating women's health tomorrow and every day. Let me go back to the questions. So somebody had, Althena had asked, do you believe in hormone replacement therapy for teenagers?
I think that's a really good question. I think we have to ask ourselves, what are we trying to accomplish with teenagers? I have seen one female in my practice recently who had extremely low estrogen. Okay. She had premature ovarian failure at a very young age, and she was very emotionally unstable. And so for that patient, I actually did prescribe estrogen, not for a long-term solution, but for a short-term solution as we're working on the other things, because it dramatically helped her mood, her sleep, her overall disposition, and it gave us room to work on those other things. However, it was a long conversation about the intent of the use and the length of the use and what we're going to try to accomplish with the use, right? And so I think the question goes back to, what are you really trying to accomplish? What's causing the problem? It's usually not a primary problem. It's usually a secondary problem, to Lori's point earlier. And so making sure that we're working on those secondary issues, cleaning up the metabolic dysfunction that's creating that challenge.
That's great. Anyone else have experience they want to share with a teenager on that?
I haven't.
Okay. All right. Also, what is your comments about a keto diet? Do you all ever recommend a keto diet?
Yeah, so I always say I don't subscribe to a single way of, there are a lot of dietary methods out there that can be very useful in the short term. So there are times that I will use keto in the short term, oftentimes for insulin resistance and such. But again, I always take them back to the core principles that I believe hold true no matter what. It's whole food, farm to plate, organic, non-GMO, nutrient dense diet. And within that, there are times that I will take fat up a little bit higher, take protein up a bit higher, right? To manipulate something diagnostically or a symptom that they're having. But I won't usually keep them there for a prolonged period of time unless you're really careful about kidney function and overall all of their labs. Because remember, these dietary strategies, often you'll see improvement in some of their diagnostic lab work, but you'll actually see a major change in an unfavorable way with others. So yes, in the short term, not long term, go back to your core principles: whole food, farm to plate, organic, non-GMO, nutrient dense diet.
That's right. I agree. I do the same thing.
Yeah.
Awesome. That is, I believe, all our questions. We have people from all over the world, including we have a customer at Human from Ukraine. They actually have our formulas over there and practice functional medicine at a large clinic. So it's very exciting they're here. I'll have a follow-up email. It'll have links. I'm also going to put a link into the podcast Synergy. I love that podcast. I listen to it when I walk Poppy in the morning. If you have any questions for me, please feel free to reach out. I can't thank you guys enough.
Absolutely.
Thank you,
Thank
Joelle.
you. What
Thank
an
you.
honor and a privilege. Yes, absolutely.
Thank you. Thank you.
Happy Friday, guys.
Happy Friday.
Happy
See you later.
Friday is right.
Bye-bye.
Bye.
Mm.